of Community Health System's neurosurgeons have more in common than just their dedication to treating patients. Dr. Ian Johnson and Dr. Derek Taggart are both decorated veterans, and both feel called to provide top-notch medical care to the men and women who have served our country.
Good afternoon, Chief. How are things going for you?
Good, sir. Good.
Neurosurgeon Dr. Derek Taggart spent years as an officer cadet at the United States Air Force Academy in Colorado. Now you can find the Air Force veteran helping patients like retired Air Force Chief Ronald Compton.
When he came to me, he had had some terrible pain in his leg anytime he stood up or tried to walk.
Ronald needed surgery on his spinal cord due to arthritis, but before getting into Ronald's medical history,
we were able to share some of our own Air Force experiences, whether it was some sort of basic training or even more recently, sharing deployment experience and having that be a nice way to alleviate fears and let down some of the guards that people come into an appointment with.
Ronald said he immediately connected with Dr. Taggart.
Oh, I was impressed from the get-go. When I seen that he was a graduate of the Air Force Academy and the discipline that they put on those boys up there, and he graduated with honors, case over. Let's get this done.
The trust and foundation was built between doctor and patient because of their military bond. Lieutenant Colonel Ian Johnson is also a neurosurgeon in the community health system.
Being able to provide neurosurgical care to active duty members and to reservists and to veterans is important to me. I feel as though I'm a very good provider of care, and I feel that they need that, and not everybody's getting in line to do it.
Dr. Johnson explains when a physician who is a veteran like himself treats a veteran, the walls come down easier.
I always hear the first 5 or 10 minutes are going to be about their experience in the military. And then it's nice because I personally and Dr. Taggart can personally bond with them and establish credibility with them early.
That credibility led Ronald to place his trust in Dr. Taggart, and his spinal surgery in April was successful.
I'm just totally grateful. I mean, if I wouldn't have found him, I wouldn't have been sitting here today without any pain down this leg.
I truly couldn't be any happier for him. He had an amazing response to surgery.
Both surgeons say they're glad they can provide care to local patients so people don't have to travel out of the valley, especially for those military veterans.
They serve this country and we owe them that care.